Okay, so I'm gonna try something. Please don't leave me hanging. Okay? When I say OF, you say yay. Can we do that? Okay. OF, OF. All right. So yeah, we are OFA group, and Isaac will tell you why it was special. But it's been such a pleasure working with the team, working with Jess, our fellow, and having all the entire staff on our team as individual advisors for the interns. We have so many stories of how our 7 a.m. team meetings also went. But I can tell you that Stuart for sure loves PCS because he wears the sweatshirt to every team meeting and every Monday class. Um, Irene loves her job in IT, but there's always some drama with people calling at 7 a.m. in the morning for a pop-up on their laptop that she cannot fix. But she always tries. And for Isaac, he's going to be such a fluent Latin speaking very soon as far as he passes his Latin classes because he's doing such an amazing job. Finally, for Suraj, Suraj has a very nice sense of humor that, tickled me a bit at the beginning of the semester, but we all got along. Um, a very interesting story because I have seen each and every one of them grow in their capacity as consultants, as team leaders, as friends, and they have made my job very easy as a team lead. I'm going to highlight Isaac's love for graphs. So, our very first meeting, Isaac, who is a latest major, made a bar chart that was a compilation of rectangles. And I found out because I was trying to change the color of one of the bars from blue to green, and the rectangle was moving. But bar chart shouldn't be moving like that. But right now, you'll see that he has grown, like everyone in the team, and so proud of how we've worked with all our 4 individual clients to bring this interesting feedback to you and research-backed insights. And I hope you enjoyed the presentation. I'll just welcome the team right now to carry it away.
Thank you, Peace. Humanities majors for the win. So we are OFA. As Peace said, we're a little bit special, a little bit different. As opposed to team-based consulting, we offer one-on-one consulting for our clients. My name is Isaac Trachtenberg. I've had the pleasure of working with Tammy this semester on the Be Glad journaling app.
And my name is Suraj Patel. I've had the pleasure working with MetaFund and Dr. Evan Fry on the Pay for Success Dentistry project.
My name is Irene. I've had the pleasure of working with the Amazing Waste Company and Donna Jackson.
Hi, I'm Stuart Yamashita. I've been working with Western Industries Corporation on ProPack.
So the Be Glad journaling app is an app in the early stages of development that is intended to help end users improve their mental health through positive journaling prompts. Throughout this project, I've worked to establish a target market, a value proposition and marketing strategy for that target market, and ultimately propose a financial model. The biggest takeaway from this project is that the app should focus on teams and utilize a customizable prompt template. So by using a customizable prompt template to appeal to teams, the app sets itself apart from other apps that are currently on the market. Additionally, from a business perspective, it can capture more end users at once by going to teams as opposed to going to individuals. It also focuses on collective mental health as opposed to other journaling apps that are currently on the market, which focus on the individual as opposed to the group. Furthermore, the app will be paid for by the organization as opposed to the individual. Now, this team-based approach has been confirmed in interest by 2 different settings, one from an HR representative at a media company, as well as a former president of a sorority here at OU, confirming that this team-based approach is something that is desired. However, the app should launch on college campuses as opposed to in the business setting for a couple of reasons. First of all, I've confirmed interest across 150 students. 75% of them expressed interest in a journaling app for mental health. Additionally, marketing costs will be less expensive starting on college campuses. Furthermore, the app will be able to appeal to more groups by launching on a college campus as opposed to focusing on one business. Going to one campus, you're going to have many, many organizations at once. For example, here at OU, we have Greek Life, Housing, and Camp Crimson as potential organizations that could purchase the app. So there are a potential over 1,500 potential users here at OU. However, the app will only need to sign 350 users in the first year to break even. There's an $8,000 upfront cost for development. We signed 350 users in the first year. We can break even, then spend more money on marketing costs and expand to other campuses. With a cost of $40 per user, this app fits somewhere in between other journaling apps that are currently available, as well as other mental health apps that are available for teams such as Headspace or Calm. Now, the next steps of this project will revolve around getting the app developed, then eventually spreading to college campuses, and ultimately looking to expand into the corporate setting. Thank you, and I would like to pass it off to Suraj.
Thank you, Isaac. MetaFund is a community development financial institution venture capital firm, and in conjunction with Dr. Evan Fry, we are seeking to create a pay-for-success dentistry project. The PFS funding project is a new initiative to help secure upfront funding for social impact projects. The premise of this project is being able to provide preventative oral health care to Oklahomans, as well as decreasing the total number of ER visits related for oral health concerns. Throughout my project and throughout the phases, the key insights to date revolve around being able to identify a value proposition that shows the potential cost savings from visiting a ER room as well as visiting a dentist. Furthermore, being able to determine which intervention would be best suited for this PFS structure. Currently, the issue revolves around the lack of oral health awareness and education within Oklahoma. Furthermore, adding the lack of dental clinics being able to serve those in need, which has led to deteriorating economic and oral health of Oklahomans. These factors have led to approximately 24,000 yearly ER visits, which has led costing the state of Oklahoma an estimated $50 million a year. Taking a closer look into the value proposition, we're able to compare the visit of a dental procedure such as a simple extraction when visiting the ER, which would cost the state an estimated $1,900. However, compared to visiting a dentist, it would cost the state an estimated $200. This has an estimated savings of $1,700 per patient for a simple extraction procedure. The patient is also able to receive the proper care that they need as well as the proper education. When researching the potential interventions which would be best suited for this pay-for-success project, the nonprofit partnership and the ER room diversion stood out. The nonprofit partnership would revolve around partnering with nonprofits who already focus on oral health care within Oklahoma. The ER room diversion would revolve around setting up a structurally referral program which would help patients have a more prioritized appointment, such as the next day, meaning they would be able to get the care that they need from a dental provider within the network clinics. Throughout my research, the intervention that I would recommend that would be most viable for this PFS structure would be the ER room diversion because of its previous proven success in other states. Now, how does the PFS structure work? We've identified the issue and we're able to provide the evidence. We have our areas of need. Once we select an intervention, we're able to provide this preventative oral health care as well as education that is needed to these Oklahomans. This would lead to better dental health as well as less ER visits in the state, which would meet the success criteria set forth within the pay-for-success contracts with the state, which would lead to our back-end payment, help our upfront investment, which could potentially be provided by MetaFund, a social impact investment venture capital firm. The next steps of my project would revolve around determining which intervention would be most feasible for this pay-for-success structure, assembling a contract with the state of Oklahoma, as well as determining what those success criteria would be in order to receive the back-end payments. With that, I would like to pass it off to Irene.
The Amazing Waste Company aims to understand how it can provide value to the waste disposal systems of healthcare facilities. The company has a device which is known as the Piranha, and this device reduces the volume of waste to about 25 to 60% of its original volume. Of the total amount of waste generated by healthcare facilities, 85% of those are non-hazardous general waste. These are the wastes that the Piranha device will be targeting. Interview done with the Dell Setting Medical Center showed that these hospitals are interested in the value that the Piranha has to provide in terms of efficiency as well as the cost reduction to the hospitals. My objectives throughout the semester has been to identify a target market as well as find the value that the Piranha could have to the healthcare facilities, propose a business model, and build up a financial model for the Amazing Waste Company. On the onset of the project, of the first side of the project, which is identifying a target market, the research has shown that General Hospitals represents a $3.7 million market size in the state of Oklahoma as well as Texas. Now, this is twice as much the market size for children's hospitals and nursing homes. Some key features that showed up for these ideal markets include hospitals that utilize a compactor as well as having a holding room. Another key insight from these targeted hospitals show that they use on average about 5 dumpsters. This could go up to about 9 dumpsters for hospitals that generate a lot more waste. Now, these said hospitals also showed interest in wanting to reduce the total cost that they spend yearly in the dumpster expenses. With the Piranha, they could reduce their cost up to about $18,000 a year. Now, how would Amazing Waste Company make these Piranha device reach out to general hospitals? The company can incorporate third-party logistics companies into the business model for ease of customer reachability. The third-party logistics companies would act as a liaison between the Amazing Waste Company for transferring of the Piranha to the general hospitals. Now, the benefits of using our third-party companies include that these companies would handle the logistics, the distribution and order fulfillment associated with this process, whereas Amazing Waste will focus solely on manufacturing and production of the Piranha device. With this, the cost flow to the Amazing Waste Company would primarily be in terms of manufacturing, production, and the contracts with the third-party companies, whereas the revenue flow would be in terms of the leasing of the Piranha at a yearly basis. Now, taking into consideration these costs from manufacturing and contracting, as well as the revenue flow from leasing a Piranha, Amazing Waste will break even in the 3rd year and will have a total 5-year profit of about $522,000. Now, key assumptions to make here are that the Piranha would be leased at a $750 per month basis, and that there is an incremental successive growth rate for the startup company of 1% each year. With these insights throughout the semester, the next step for the Amazing Waste Company would be to apply for grants from states and private institutions in order to finish up the pending patents for the Piranha device, as well as grow into the general hospital markets. Thank you. With this, I will now pass it on to my colleague.
Thank you, Irene. Western Industries Corporation is a custom packaging company aimed at delivering efficient and effective pack solutions to their clients. They entered the ERP market looking for a solution that would fit their business, but they didn't find one, so they developed their own in-house ERP software called ProPack. ProPack has a unique raw optimization module that allows WIC to limit waste in the manufacturing process. They want to know if this software is profitable. So far in the duration of the project, I've gained an understanding of the market, outlined a pricing strategy, and researched successful spin-off needs. The most important insight to date is that ProPack should market the software as an ERP add-on, specifically using the raw optimization module. The market for this software would be $10.2 million. This comes from the total ERP market of $10 billion in the United States. But due to the nature of ERP add-ons, they must partner with ERP vendors, and the ones we selected represent 31% of the market. The raw optimization module must also work with cutting manufacturers, which represents 3% of the market. With a capture rate of 10%, this leaves a $10.2 million market. This capture rate may fluctuate, though, depending on the uniqueness of the raw optimization software, as recently there has been identified similar software already on the market. ProPack should be priced at $250 per user per year, as this would allow 75% of the market to afford the software. Right now, 75% of the market spends more than $2,400 per year per user on software. The majority of this funding does go towards the ERP software and its support, but this would allow 10% of the funding to go towards ProPack. The business model allows for 2 revenue streams, the first being the implementation fee, which occurs at the purchase of the software. It only occurs a single time, and the licensing fee would recur every single year for each user. The 3 major costs for ProPack would be the IT implementation, the IT support personnel, the implementation personnel, and the marketing costs. Those costs would go towards sales representatives and trade shows. It's important to note that ProPack should be a cloud-based software, as this allows the software to be easily distributed to the clients and updates to be sent out without having to go to client sites. Ideally, ProPack will break even in the 4th year, becoming profitable in the 3rd year, with the major cost in the 1st year being the development cost of the app. Although that development cost can vary quite a bit, it still leaves a lot of room to break even in the 4th year. To successfully enter the market, ProPack should first program the raw optimization module to run as a third-party software, and then consider launching a pilot program to outline the specific needs to successfully implement the software in a client. Lastly, they should contact the Oklahoma Manufacturing Alliance to leverage that relationship for future clients. Thank you for your time and attention. I would now like to open the floor for questions. These would target the small, mid-size, and smaller on the larger size manufacturers that would be best suited for ProPack. And it also captures the majority of that market without using the many small ERP providers that are also out there.
That's a great question. So the question was about advertising to housing specifically, and covering the cost, essentially. Is that correct? Am I understanding that? Yeah. So ideally, the cost would not be funded by the students. That would come from the administration, and this is something that would provide value overall for the mental health of the team. So my research didn't take me to the exact ins and outs of the budget specifically for housing necessarily. However, with 150 RAs roughly, that would be a reasonable cost that the university would be able to afford just based on how much value it would provide for their students.
So the question was, what might be the largest implementation challenges? From my research, the largest implementation challenges would be having a cooperative discussion with state officials, whether that be legislators or state officials within Medicaid or any other health services, such as the Oklahoma Healthcare Authority. Just having a cooperative discussion with them, as well as dental professionals and hospital ER rooms. I know they're very picky with their data not being shared, so the total cost, but we were able to identify some cost savings. But I would say that's the largest implementation issue, is getting everyone on the same page.
So the question is why in the model it's a leasing and instead of selling out the device. So it's leasing out the device for about $750 a month would be able to provide the Amazing Waste Company with a yearly profit of $9,000, and with successive years, this would also provide additional profits to the company as opposed to a one-time sale. So there is like recurring customers as well as retaining the old customers that the company would have had.
Time for one more question.
For BGLAD, is this supposed to be a University of Oklahoma specific app, or is there practical applications in other universities?
The question was if this app could be used at other universities outside of OU. Definitely something that would provide value in different settings outside of OU. My research was focused specifically here because that was what was available to me. However, this model could be replicated at other similarly sized universities where there would be the same kinds of organizations on that campus.